Welcome, everyone. We're still having a couple people trickle in here, and then we'll get started. I want to assure everyone that we are going to be recording this event, and we will be sending you out a link to the recorded event. So if there's any technical difficulties during this session, then rest assured that we will be sending you the full recording. I'd like to welcome you to Untangling the Challenges of Aging. This is our first session for 2023, our free educational series presented by Willamette Vital Health. And this session is on dementia, options for care and support in the community. We're thrilled to have Dr. Melissa Cannon with us, Professor of Gerontology at Western Oregon University. We're able to put this session on due to our generous sponsors. Our title sponsor for this series is Call Your Law. Our presenting sponsor is Salem Health, and we're also thankful for our corporate sponsors, Norco, Kay Johnson from Windermere Real Estate, and Salem Clinic. Special thanks to our partners at Western Oregon University, of course, as well as Center 50+, who will be hosting the other two sessions in this series the next 2 Wednesdays. If you haven't registered for those sessions yet, you are welcome to do so, and we would love to see you there. We'll be serving some refreshments, so we'd love to have you register so that we know that you're coming at wvh.org/untangling. A few housekeeping items here. You'll see a Q&A box. Hopefully you see a little question mark at the top of your screen, and you can type your questions in. We'll have some time for questions at the end, as well as a chat box if you're having any difficulties. All the donations and proceeds from our sponsorships go to our grief care programs here at Willamette Vital Health that are available to anyone in our community, children 6 and up, as well as adults and families. So with that, I will turn it over to Dr. Cannon. Thank you so much for being here today.
Thank you very, very much for having me. I really appreciate it. Okay, well, we'll go ahead and get started. So yes, I am an associate professor at Western Oregon University. I'm also the department head of the Gerontology Aging and Older Adulthood program. We really value our partnership with Willamette Vital Health, so thank you so much for inviting me to be part of this wonderful series. And yes, my presentation is Dementia, Options for Support and Care in the Community. Next slide. All right, so just to give you an overview, I am going to be talking a little bit first just about dementia and Alzheimer's disease, just to kind of highlight some facts and figures. And then I will talk about unpaid caregiving and support options for those individuals. Finally, I'll talk about paid caregiving options that are in the home and in the community. And then I'll just give some final thoughts and leave some time for Q&A. Next slide. Okay, so just to start off with an overview, what is dementia? Oftentimes, dementia and Alzheimer's disease can be sort of confused as like the same sort of thing. So I think it's important to just kind of start off with a little bit of an explanation of how to distinguish the two. So dementia overall is a syndrome. It's a set of symptoms, and it is progressive. There are actually over 70 different disorders that can cause dementia, and the main commonality is that it is a progressive process that involves losing brain function, and that's because the neurons are being damaged. And so this is something that is happening in the brain and is kind of over time getting worse and worse. And this is always a helpful image to show. So like if you're thinking about dementia, a helpful way to think about it is as an umbrella. And underneath that umbrella, there are a number of different types or causes of dementia, Alzheimer's disease being the most common. And again, it's an umbrella term, so you can kind of think about it as, all of the different kinds of symptoms that a person might experience, which I'll talk about what some of those symptoms are. here in a moment. And generally, what we see is that it affects memory, thinking, language, judgment, and emotions. But depending on the cause of dementia, there's going to be a different sort of set of symptoms associated with that. And of course, like you see on the picture here, vascular dementia is the second most common, and often that is followed by strokes. But the first most common is Alzheimer's disease. So I do want to kind of just give a quick overview also of Alzheimer's disease. Next slide. Okay, so this comes from the most recent Facts and Figures report from the Alzheimer's Association. Most of the facts here that I'm going to go over do. But yes, Alzheimer's disease is a disease, and so you can kind of think about it as cancer or some other kind of chronic disease, and it does represent about anywhere from about 60 to 80% is the estimate for all the cases of dementia. It is the 6th leading cause of death overall, and the 5th leading cause of death among older adults. And currently, the estimate is that about 6.7 million Americans have Alzheimer's disease. And this is a growing concern because by about 2050, the estimate is that it will rise to about 13 million people who are living with this disease here in the United States. Some of the challenges with Alzheimer's disease is that we don't know for sure what a lot of the causes are, like what the risk factors are. We know that age is the best known risk factor. So we know that as you get older, your risk increases, but we don't really know in terms of how to prevent it, what sorts of things, what we know for sure, what sorts of things could help. And the other thing that's tricky with Alzheimer's disease is that the progression is going to be very different from person to person. So in terms of what symptoms they experience, it's just going to look really different for each person. There are general stages, which I'll talk about here in a moment, but in terms of how it manifests, it's going to look just different for each person. Next slide. I'm sorry. Yes. Oh, and yeah, just sorry, that last point. Yes. So most of the medications that are available right now are targeting the symptoms. So they might help people stay independent for longer because they might alleviate some of the memory loss or anxiety or other things that are happening. But there is no cure as of right now. But one thing I will say is that there have been exciting breakthroughs in the last couple of years in terms of FDA approved medications that are specifically targeting the amyloid plaques in the brain, which is one of the hallmarks of Alzheimer's disease. So we're getting to a point where we're shifting from just targeting symptoms to actually targeting some of the underlying things that are going on in the brain. So I think there's a lot of hope when it comes to the medications that are starting to now be available to folks. So, okay, next slide. All right, so I mentioned I would go over some of the more specific symptoms. So depending on the stage of the person, they're going to have some level of severity of a couple of different symptoms. And to be sort of diagnosed with the Alzheimer's disease, there's a minimum of 2 of the following. So one of those could be difficulty with making plans. So that's kind of like acquiring and remembering information so that you can use that information later. Managing finances would be an example, like a person might have a hard time with those complex tasks. Oftentimes a person will have visuospatial issues, so they have a hard time recognizing or finding objects. Oftentimes language is impaired, and so communication becomes really difficult. And then also the change in personality, behavior, comportment, so like mood changes. And again, it's going to be really different for each individual. But for it to be considered Alzheimer's disease, the importance here is that you would be having at least 2 of these issues and that they would be severe enough to interfere with daily life. So that's where, people start to need a lot of intervention. The other thing is that with Alzheimer's disease, a lot of times people experience anxiety, depression, for caregivers, the challenges can often be, not only those sorts of issues, but having a person be more combative or less empathetic or perseverate. So they have a hard time getting out of an emotional state or off of a particular idea. So next bullet point here is that, caregivers have a number of challenges and needs. And when you compare people who are caregivers of those with dementia to people who are caregivers of people without dementia, there's a huge difference in terms of like their stress and some of the health challenges that they experience. So that's why we focus so much on the needs of caregivers as well as the care recipients, because they themselves need a lot of support. Okay, so we'll go to the next slide here. All right, so getting to caregivers, unpaid caregivers really are considered the backbone of the long-term care system. It's hard to know exactly how many are out there because a lot of people don't self-identify as caregivers, but we do know that 83% of all care to older adults comes from family, friends, or other unpaid caregivers. Over 11 million Americans are providing care to people with Alzheimer's disease or some other cause of dementia. Some other just kind of statistics or demographic facts here are that about 2/3 of caregivers are women. About 2/3 of them are white, and about 2/3 live with their care recipient. And importantly, the national economic value of this unpaid caregiving comes to about $340 billion per year. So it is a huge amount of unpaid care that is being done sort of behind the scenes. So that's like why we call it like the backbone. Okay, next slide. Just some more kind of things about this. So over half of unpaid caregivers are caring for their parents, and about 10% of them are caring for their spouse. And most likely these are the women in the family. So if they're caring for parents, it's most likely going to be daughters and daughters-in-law. And if it's spouses, it's much more likely that it's wives compared to husbands. And I should say too, as a caveat, we don't have much data up to this point in terms of LGBTQ couples, but hopefully that will be part of our data that we have available later. About 30% of caregivers are 65 and older themselves. And so when we talk about the host of challenges that caregivers experience, it's important to keep in mind that they themselves are oftentimes older adults, and 41% have household income of $50,000 or less. Another thing that's really challenging right now is that about 25% of unpaid caregivers are in what's called the sandwich generation. So that means that they're not just caring for people who are older, like older relatives, they're also caring oftentimes for their children or grandchildren, so people that are younger. So they're kind of sandwiched between caregiving on both ends. So these are just some of the issues that are going on right now with people who are unpaid caregivers. Okay, next slide. In Oregon specifically, just a couple more data points here. We have about 168,000 family caregivers, which amounts to about 317 million hours of unpaid care. And that's, again, an estimated value of like a lot of money, $7.2 billion. So I mentioned that caregivers of people with dementia have oftentimes higher levels of like stress and health conditions. In Oregon, 60% of people who care for people with dementia report having at least one chronic condition, 29% report having depression, and 15% report having frequent poor physical health. So again, just to emphasize the needs that are out there before we kind of start talking about the options that are available. Okay, next slide. Okay, so I'm going to talk a little bit about just general categories of support for caregivers, and then I'll get more specific into like what we have available here more locally. But one of the most important kind of pieces of support for caregivers is called respite care. And so respite care very simply is just having relief, having time to go and do self-care, whether that's, shopping or getting your haircut or having time to sleep, anything that would be kind of considered some time that would be like relief from caregiving responsibilities. And so we have a number of options for that, things like adult day services, which I'll talk about a little bit later here, or overnight stays. Some long-term care facilities offer overnight stays. You might have heard of an organization called Visiting Angels, and this is where an organization like that might be very helpful to connect with, to see if, even for just a very short period of time, somebody can come and be there with your loved one. This not only reduces stress for the caregiver, but a lot of research has shown that it improves the well-being overall of caregivers and their recipients, and it improves the relationship that they have while caregiving. So there's a number of really, there's a number of benefits that have been proven strongly by the research done on this. The primary barriers to respite care that people have are lack of awareness, and that's where, hopefully we can start to help people be educated on how to receive respite care. But then, also some people are resistant to seeking help. They kind of want to take care of it themselves. They may not feel comfortable with a stranger being involved. And then there's also the lack of affordability or accessibility. In not every community is there going to be easy access to respite care, and it may not be affordable for folks. But we do usually have we have a number of good options, I would say, here in our community. So I'll kind of talk about how to seek those out here in a moment. But so that's respite care, and we can go to the next slide here. So other kinds of support that are really crucial for caregivers are case management, and case management can happen in a number of ways. Oftentimes it is through the Area Agency on Aging, which I will talk about also in a moment. But you can get connected to somebody to help with assessing your situation, providing some information, referral, overall just kind of planning and care coordination and or advocacy. So case managers kind of are in a lot of different roles kind of in our communities, and are there to help navigate all the different resources that are out there. So that's really important as well. Another thing that's really a great support for caregivers is having counseling or therapy. Counseling in particular can help with kind of resolving some of the personal issues that might complicate the caregiving relationship. It can reduce conflict, it can improve family functioning, but also therapy can be helpful for developing behaviors that help with coping and help with overall improving one's well-being. So, some cognitive behavioral therapies perhaps can be helpful with this sort of process. Okay, next slide. Finally, there's educational support, and something like what Willamette Vital Health does, like with this series, is a good example. Educational support is huge for a lot of caregivers because they just don't know, they're just very unfamiliar with this whole situation and what to do. So this can be helpful in terms of learning more about the disease and what to expect, providing resources, connecting with services, and also just learning kind of skills for managing. And there are some really amazing educational resources out there here in Oregon. And then support groups is another huge support for people. This allows people to get together with others who are dealing with similar circumstances, and in a very semi-structured way, just kind of, talk about their personal feelings, concerns, share resources with each other and skills and tips. And then, especially overcoming isolation, because caregiving can be a very, very isolating experience. And that's one of the main contributors to depression for a lot of caregivers overall. All right, so we can go to the next slide here. I put this slide on here just to kind of help folks know that, when we talk about what's available in our community, it does oftentimes start at the national level. So everything in the field of aging generally, like a lot of the aging services that we have available to us, are funded through what's called the Older Americans Act, that was passed through the Administration on Aging. And resources and funding are kind of funneled down through states and then area agencies on aging, and then we have them available in our local communities. Oftentimes places like senior centers are great places to get access to any sort of resource. So if at any point, you're wondering where to get started, a senior center, literally walking in the door there is oftentimes a really good place to get some answers and get connected. But every community is going to have different things available based on just, the funding that's available and also just kind of the needs of older adults within that service area. Okay, you can go to the next slide here. All right. So at the national level, again, just kind of thinking from like the sort of larger picture down to the smaller picture, we have the Family Caregiver Support Program at the national level. And this is providing a lot of grant funding for programs that we have locally. So this is where we see a lot of services like caregiver counseling, legal assistance, home modifications, transportation, technology, emergency response systems, those sorts of things, as well as some of the things I mentioned earlier, like support groups. This kind of funding also helps with funding caregiver training that's evidence-based. So oftentimes a university will partner with an organization to test out some sort of training model. And we have some really good evidence-based training models here, like are listed here, the STAR-C and SABI trainings. These have been implemented and actually show that people who complete those trainings specifically have improved their ability to manage the caregiving experience. So it's really important to have this funding in order to make these programs actually work and to know that they work. And then, a variety of types of respite care also come from this sort of national level, down through state programs or state grants. Okay, you can go on to the next one here. Yeah, lots of information that gets provided as well. Okay, next slide. Okay, at the national level, another kind of advisory council that exists is called the RAISE. This is the Recognize, Assist, Include, Support, and Engage. It's a family caregiving advisory council. And so this is another source of where we're getting support from the national level. And they have the goals of essentially increasing awareness of family caregivers, engaging family caregivers as partners in healthcare and also in long-term care. Go to the next couple points here. They connect people to services and supports. They provide financial and workplace security for family caregivers. This is a big one right now. A lot of family caregivers report that they need more, and they need financial support, and they also need more flexibility from their workplace. So having kind of a national program that is advocating is really important. And then also, again, that body being able to help generate like more research and data and evidence-based programs. This is really important as well for kind of, those interventions. Okay, you can move on to the next one. So here in Oregon, again, this kind of trickles down. So from the national level, Oregon, we have a family caregiver support program, and it's hosted at the Oregon Department of Health and Human Services. So if you were to go to their website, it's a really good place to start in terms of finding out about trainings and resources and all of the things that I mentioned earlier, like respite care, support groups, those sorts of things. So that's a really wonderful resource that we have available here in Oregon. I'll talk about Medicaid here in a moment and what we have through Medicaid, but another thing for people that don't qualify for Medicaid is Oregon Project Independence. This is a state-funded program where people can essentially just pay $5 of an annual fee and be enrolled in to access a number of services. One of the challenges with OPI is that there's usually a wait list, and it's they kind of rely on being re-upping funding every cycle, and so depending on what's available and how many people are on the wait list, it might be more helpful than or not. But this is a really wonderful program that we have available here at the state level. The big takeaway that I always like when I do these kinds of presentations, always what I encourage people as a first place to start, aside from a senior center, is the ADRC of Oregon. This is a website that you can go to. It is a comprehensive resource directory. So regardless of what you're looking for, if it's looking for respite care, or if it's looking for actually like live in memory care or training, those kinds of things, this is going to be a really good place to start. So the adrcoforegon.org is sort of the connection to everything that is available, and it's organized so that it shows you what's available at the county level. So they work with our area agencies on aging to provide that information out to communities. Okay, next slide. Just a couple other things specific to Alzheimer's disease. We have a state plan on Alzheimer's disease in Oregon. And this is something that is kind of right now, like majorly focusing on caregiving. It's a partnership of different organizations that are coming together to kind of come up with what sorts of resources and trainings and things like that can be available for caregivers. In terms of training, one of the things that I think we are very fortunate to have here in Oregon, we're fortunate to have a lot of really great things available that a lot of states may not. But Oregon Care Partners is a state-funded training program that provides free virtual trainings on a variety of different topics. Paid caregivers can use these trainings to get their training requirements done if they're working like in a memory care setting, for example. But it's also just super helpful for family caregivers if they're looking for basic trainings on how to navigate being a caregiver. So that's a really important one. We also have support for our Indigenous and Native American communities through the Native Caring Conference. And so they are specifically serving minority groups in the area that identify with those communities. Okay, all right, and then more at the local level. Thanks. So I mentioned the Area Agency on Aging. The one that, if you all are kind of living in the Salem area, or I'm down here in Monmouth right now, but the Area Agency on Aging that covers us is called Northwest Senior and Disability Services, and they serve Clatsop, Marion, Polk, Tillamook, and Yamhill counties. And this is, they work very closely with that ADRC of Oregon. So anything that you find in that database, they're going to send you to what's locally available through the Area Agency on Aging. So they kind of, all work very closely together. And they themselves are kind of a resource directory, because this is where we have a lot of case managers and people who are like information and referral specialists that will refer people out to what's available. Each county also has a family caregiver support specialist, and so you can specifically, as a family caregiver, have access to that person and the resources that are available there. Of course, we have some other wonderful programs. Alzheimer's Association broadly is providing a lot of really wonderful resources in the community. We also have the Alzheimer's Network of Oregon that works throughout the Willamette Valley, and they host programs such as the Music and Memory, which is a program that allows people to use music as a way to help facilitate communication with their loved ones. So we do have some of these organizations as well that have just excellent resources available. Okay, next slide. I think, there you go. All right, and then I'll just mention too, you know, for a lot of folks, they can access paid caregiving as well. And there's a few ways to do this. If you're paying like out of pocket or using insurance, a lot of people are able to hire, you know, someone like visiting angels or other direct care workers, and they can help, you know, individuals within their home. This is a huge area of need and growth, potentially with just the aging of our population. We're expected to see this be the largest need than any other single occupation here in the United States. The kinds of in-home caregiving, it depends on the needs of the individual, but someone can be a homemaker where they provide more of the hands-off care. You might think about instrumental activities of daily living like cooking, cleaning, running errands, doing those kinds of things. Or a person might need more personal care. This would be like home health aid services, such as visiting angels. So those are available through a number of agencies, like I said. And one of the things that we're seeing now through the research is that as much as possible as we can have these kind of models of collaborative care, so people who are working together, like social workers, pharmacists, nurse practitioners, if they're using a team-based approach, this is the best sort of way to prevent people from having to leave their homes. So if your goal is to keep people from having to go to be admitted to the emergency room or the hospital or a nursing home or memory care, this is one of the areas that we're going to really need to see available to folks in the community. Okay, next slide. I mentioned Medicaid. We have here in Oregon a Medicaid waivers that are called home and community-based services waivers. And these do allow people to access services like case management, housing support, transition services. And this is available in all Oregon counties. There might be a wait list. That is very typical, but you can apply to the Medicaid program for these services, and oftentimes that is a way that people can get that support. If they can't pay out of pocket, Medicaid can cover a lot of this stuff. So the ADRC is the place to go and learn about these HCBS waivers. Okay, next slide. I think there's just a few more. Adult day services, this is a huge thing for folks. Depending, again, on the person's needs, they might just be looking for more of a social adult day service option, or they might be looking for, you know, something that involves maybe having trained staff that can provide like therapy or medication. But we also have specialized adult daycare, and they have supervision specifically for people with dementia. This is a great option for respite for caregivers, but it's also a great option for individuals who have dementia because it does support like a range of their needs, like physically, emotionally, and cognitively, and socially. And this is a great, also cost-effective way for people to help remain at home. Here in our community, Center 50 Plus offers, they have adult day services. And if you're further down south in Corvallis, the Grace Center is also an option that is really wonderful. All right, next slide here. Okay, and I'll finish up. This is pretty much one of the last slides here. So, we, there are also live-in options, and I don't focus on that so much in this presentation. But of course, if a person needs an option in their community where they can actually move into, we have 3 kind of categories of community-based care here in Oregon. We have assisted living, which most people are pretty familiar with. They are self-contained units that provide some services, right, for supporting people to be independent. We have residential care, which tend to be smaller living quarters that are state regulated. And then we also have memory care. And this is something that the Oregon Department of Human Services created as an endorsement for existing facilities. If they can meet requirements for their training, staff training, and their physical space, they can provide memory care at their communities. So we're seeing that memory care is the fastest growing portion of community-based care options here in Oregon. So I would expect that we'll see a lot more memory care options moving forward here in the state. Okay, next slide. All right, so I'm just going to end with some final thoughts here. So we have a lot of different supports, both for people who have dementia as well as their caregivers. We have a lot of ways to support people, both, in physical, emotional, cognitive, and social ways. One thing that's just important to keep in mind is that every person is going to be really different, depending on who they are as individuals, depending on the stage of the condition. So it's really important to tailor care and support as much as possible to the needs and preferences of individuals. For example, not every individual is going to go for adult day services. They just may not feel comfortable going into a new setting with people that they don't know and doing activities, right? So every person's going to be different. The other thing that I just really think is an important takeaway is that we really need to, as much as possible, be involving healthcare professionals and specialists that know about dementia, that have been trained in dementia care. And this is an area that I'm hoping we see increase just in terms of education and training in our workforce. We need to see more people entering the workforce with knowing how to serve people with dementia. So, okay, so that's all I have. On the next slide, I just have my contact information, and then we can open it up for Q&A. I know we probably don't have a ton of time, but that's what I've got.
We're doing great on time, Melissa. And I wanted to just bring up a couple things I wrote down as people formulate their questions. You can drop them into the question box that you'll see where the little question mark says Q&A. And hopefully you see a message from me in there about this is the place to write your questions. But you mentioned the different locations that people can live in. And one I wanted to point out that probably falls under one of those broad areas is adult foster homes. And sometimes I think people that are caring for a loved one with dementia don't always take that option into consideration. Do you have any comments on that option for living as well?
Absolutely. Adult foster care is a wonderful option. And I didn't comprehensively list the living setting options because skilled nursing was also not on there, but that is part of what we have available. But adult foster care homes are, they're regulated through the county, I believe, and they're, depending on where you live, you're going to see variability in how many are available. But they're really great options for people who want to be in a smaller home-like setting with anywhere up to 5 residents. Oftentimes, I did a study of looking, going and interviewing people in adult foster care homes, and there were anywhere from 2 residents to up to 5 or 6. I think 6 is the max. And they look like homes. They're just homes where they have a person who's there all the time, oftentimes multiple people, and they can do transportation out in the community. They provide everything there for that individual. So just depending on the person, I think that works really well for some folks. And it's a really great option that we have here in Oregon.
Yeah, I had grandparents that lived both in a very secure memory care facility because of one's needs and in an adult foster home because of another's needs. And so I think, how you mentioned that everyone experiences dementia or Alzheimer's disease differently, and their needs may be different for their living situation or for their caregiver for that matter.
Absolutely.
One other thing I wanted to bring up when you were talking about collaborative care models and needing more models that include sort of these wraparound services, right, where an interdisciplinary team comes together, it made me think, well, that's what we do in hospice care, right?
Yes.
And that's what we do. We also have an in-home palliative care program we call supportive care. And I find it interesting that oftentimes folks with dementia are referred late or not at all to hospice care or palliative care programs. So I just wanted to kind of comment on that, as well as the fact that supportive care programs can be available when someone is new in a diagnosis as well and really wanting to understand the prognosis of their illness.
Absolutely.
What are your feelings about getting that support on board early?
Oh, absolutely. And I would absolutely say that if a person is diagnosed and, wants to, build a palliative care team at that time, I would 100%, recommend that. And that's kind of the model that, that I think we're seeing is really effective is that team-based palliative care model. And I think Willamette Vital Health is an excellent place to start if that is a route that you're going. And there's also, through the ADRC would probably be able to be connected to options for finding, palliative care specialists who can kind of help build those teams. But yeah, it's not too late or too early. If a person is diagnosed, it's not too early for them to access palliative care. And I think that would be a really good way to start for sure. And a lot of times this is where, again, just talking to someone who's like a case manager or an information and referral specialist, that might be their first recommendation, is to get in touch with a palliative care specialist. So it's kind of referring to into the network.
And yes, right. Starting to gather those resources. Sometimes we refer to as building your team, kind of seeing who's going to be on this team to help you through this journey.
Yeah.
We have a question from one of our attendees here that asks, what's the site for the family and professional dementia caregiving training that's available? And I'm not sure if they're referring to the ADRC website, or I was also interested in that STAR, C, and Savvy training you talked about too.
Okay. So Oregon Care Partners is
Oregon Care Partners.
What they are referring to, and it's just OregonCarePartners.com. And yeah, they are where I would probably start in terms of getting getting access to the different trainings that are available. You can also go to, if you just type in your browser, the Family Caregiver Support Program in Oregon, they also have links to different trainings, including those evidence-based trainings. So either place that you start, I think you would probably wind up in the same, finding what you need, but absolutely.
That's great information. And I know that Family and Caregiver Support Program, just less than a month ago, I was talking with folks over at Northwest Senior and Disability Services and said that they have openings for that program. So definitely, if you're not already connected to that, especially because that's not an income-based program, and so anyone can participate. And my understanding is that it comes with some benefits like counseling services for the family caregiver, and a limited hour of respite care paid for as well. So it's a really big benefit to family caregivers to get tied into that service.
Oh, yeah, absolutely.
Okay, and I noticed Tyler, I put the link in the Q&A, and Tyler put the link for Organ Care Partners in the chat, so you have it in lots of different places. Let's see, we have a couple other questions here. Someone mentioned home care workers website where you can register as an employer, fill out questionnaire and submit. System will render a list of caregivers in your area. Yes, that is a service provided.
Mm-hmm. Totally. And there's other places too that I didn't mention, like I was looking at Senior Advisors website and like a place for mom, and I think you can actually get without actually paying money up front. I think you can get referred to place things in your area through those kinds of resources as well. So yeah, I mean we're getting to a point now where I feel like there's a lot of kind of shared information through different organizations, and you'll kind of be able to get where you need through them. So
yeah, and that's a good point. We have sort of these governmental and nonprofit organizations offering some services, and then we have for-profit companies also offering some of these services, and some navigation could happen both ways.
yeah.
And some people find value with connecting with both types of organizations too. So there's lots of options about where to get, and maybe that makes it harder for caregivers sometimes, that there's not just one central location to go. Right. And I think part of that depends on how much help someone needs. In terms of if you'd like a personal navigator, then one of these paid services could be helpful for you. If you are a researcher and Google is your friend, then you're probably going to find all those resources.
Yeah. Well, and in another profession that's kind of more recently been growing is options counseling, which is it's kind of like a case manager, but it's somebody who they keep you on as a case for a much more limited time, and it's really just to help you kind of navigate and make decisions on what those next steps are. So yeah, there's a huge number of different resources out there.
And the ADRC that Dr. Cannon was talking about offers options counseling also. So that's one service that's available for free that way, but you may also be able to get it through a private person to help navigate as well. We have another question here about, do you have a list, and I haven't heard of this before, cognitive occupational therapists to stave off progression of the disease? Do you have any thoughts on that?
I don't have a list, but I'm very excited about occupational therapy. We actually here at Western just started an occupational therapy program, and it's housed with us here in gerontology. And there are, people can do occupational therapy across a huge spectrum. We've had students that graduate with their gerontology degrees and then go on to be, to do occupational therapy with people. And, it can be anywhere from, some work with children, many work with people who have cognitive or kind of psychological issues, older adults who maybe are just trying to relearn some skills. There's a number of different populations that occupational therapists can work with. I don't myself have a list of people that specifically work with people with cognitive impairment, but I would be happy to ask our new director if he has any ideas. If you wanted to shoot me an email, I'd be happy to follow up with you on that.
That's a great idea. I'll put your email here in the chat as well, Melissa. So
that'd be great.
Okay. And let's see, I think I had one more question here. And that was, you mentioned those trainings that were specifically for family caregivers that were evidence-based to help people have more confidence maybe in their caregiving, as well as perhaps cope with their caregiving better. Are there any, I guess, what are the elements that make those types of training successful, and why should somebody maybe pursue that? I bet for some caregivers that feels like one more thing to do, right? And I'm just wondering about the benefits of it, and some of those components that someone might look at and think, oh, that would be really useful.
That's a great question. I think that what makes them really effective is that these kinds of trainings are led by professionals who have been trained, and or maybe, trainers who have trained other, people who can facilitate these trainings. And it's very it's designed intentionally with, a kind of specific set of, like, workshops that people do through a set number of weeks. And I believe that a lot of it is rooted in, like, psychological research, the way that they specifically, like, structure their trainings along the way. And so, they're using them as a way to see kind of like if these trainings are sort of based in what we know from psychological research, like, is that an effective way to help, like you said, people become more confident in their skills, or, show other kind of positive, like, better emotional state, better affect overall, that kind of thing. So I think it's mostly just that if there's an organization that's hosting that particular training, it's something that they've very carefully sort of structured and designed according to kind of like their research. So if you find it in your area and it says it's like the STAR-C training or the Savvy training, it's because, it's a model that has worked and has, but that being said, I think a lot of trainings out there are building off of what we've been learning from those evidence-based trainings, right? So I think you can't go wrong necessarily, but I do think that the ones that are hosted by organizations that have professionals or have been backed by research are definitely where I would want to start if I was a caregiver.
Great. That's nice to sort of have a direction to look for those who are looking for more training and support. And I really just appreciate all the resources you brought to us today and the important information. It's such a vital topic, and one I think that so many people want to learn more about. So we really appreciate you being here with us today. It looks like we've gotten through all of our questions. And just a reminder that we'll be sending an email next week with the recording, as well as some of these links if you happen to miss it today or have any technical difficulties. So any last thoughts, Melissa?
Not off the top of my head. I mean, if there was more time, I think we would have a lot more things that we could definitely talk about. But I just appreciate the opportunity to come in and touch on some of the highlights that I wanted to share with you all. And I just really appreciate the invitation. And this is such a wonderful series that y'all are doing. So thank you for letting me be part of it.
Oh, thanks for being here. And I hope that the rest of you can join us for our final 2 sessions. If you have any questions, feel free to call us here at Willamette Vital Health at 503-588-3600 or register at WVH, as in WillametteVitalHealth.org. The in-person sessions won't be recorded. The room doesn't lend itself great to sound, but it does allow for a lot of people. So I hope you can get away. And like I said, we'll give you some lunch, make it worth your while, and we'd love to see you in person. I think every year we'll continue to offer at least one webinar, though, for folks that find that easier to attend. So we'll be sending you a survey. Your feedback's really important to us. So please do fill that out. If you can just take 3 minutes to help us know how we could improve this experience or what kind of topics we should cover next year, we'd love to hear it. So thank you all for attending, and I'll hope to see you again soon.
Thank you.
Bye-bye.